Hi everyone, in today's video we'll focus on gastroenterology questions. So let's start with the first question. A 43-year-old musician is brought to the clinic by his brother due to progressive difficulty with coordination and speech over the past few months. He has been missing rehearsals and struggling to perform, leading his bandmates to ask him to take a break. His brother also notes that he has been increasingly irritable and prone to emotional outbursts. Physical examination reveals hepatomegaly, mild ascites, and bilateral lower extremity edema. Examination of his eyes shows a notable abnormality. Which of the following is most consistent with his disease process? A. Anemia of the chronic disease. B. High ferritin levels. C. Hypercalcemia. D. Hyperphosphatemia. E. Low levels of serum ceruloplasmin. Now the picture provided here is a picture of Kayser-Fleischer ring. Now Kayser-Fleischer rings are copper deposits that form in the cornea of the eye, and they are a hallmark sign of Wilson disease. These rings, they appear as golden brown or greenish brown discoloration around the corneal margin. They are significant because it indicates that copper has accumulated in the tissues, which is a key feature of Wilson disease. The correct option here would be E, low levels of serum ceruloplasmin. Now, this patient has Wilson disease, which is caused by genetic defect impairing copper transport, which leads to copper buildup in the liver, causing fibrosis and cirrhosis. The copper then spreads from the liver to other tissues, such as the brain, eyes, and other organs. The reason that the serum ceruloplasmin will be low in Wilson disease is because ceruloplasmin is a copper binding protein that transports about 95% of circulating copper in the blood. And its reduced level in Wilson disease, it's because of its reduced copper incorporation. Let's have a look at why the other options are incorrect. Option A, anemia of chronic disease, is incorrect because it doesn't explain the patient's neuropsychiatric symptoms like the difficulty speaking and the irritability. And more importantly, the eye finding in this case, which is the Kaiser-Fleischer ring, is a hallmark for Wilson disease. Option B, high ferritin level, is also incorrect because high ferritin levels are typically associated with conditions like hemochromatosis and not Wilson disease. In hemochromatosis, there are some similarities with Wilson disease, such as liver involvement, but it does not present with the Kaiser-Fleischer ring. Option C and option D are incorrect because copper toxicity actually increases calcium and phosphate excretion. A 55-year-old woman comes to the clinic because of fatigue and weakness over the past month. She notes that her symptoms have progressively worsened, and she has also noticed darker stools recently. She denies any abdominal pain or significant past medical history. On examination, she appears pale and her heart rate is 100 beats per minute. Her blood pressure is 105 upon 70, respirations are 14 per minute, and oxygen saturation is 97% on room air. Laboratory results show a hemoglobin of 6.2 grams per deciliter and a mean corpuscular volume of 68 femtoliter, and a guaiac positive stool test. Which of the following is the most appropriate next step in the evaluation of this patient? A. Colonoscopy. B. Computed tomography of the abdomen and pelvis. E. Esophageogastroduodenoscopy. D. Right upper quadrant ultrasound. E. Sigmoidoscopy. The correct option here would be A, colonoscopy. The patient's symptoms, fatigue, melena, weakness, and guaiac-positive stools, are concerning for colon cancer, especially considering her age. These signs, along with the iron deficiency anemia, suggest a possible underlying malignancy in the colon. The first step in confirming colon cancer is performing a colonoscopy, as it allows direct visualization of the colon and enables biopsy of any suspicious mass. Let's have a look at why the other options are incorrect. Option B is incorrect because CT imaging is not the first step for diagnosis. It is used for staging cancer after a diagnosis has been made and confirmed by colonoscopy. Option C is incorrect because esophagogastroduodenoscopy is used to examine the upper gastrointestinal tract for conditions like esophageal varices or gastric ulcers or upper GI pathology. Since this patient's symptoms suggest a lower GI issue, colonoscopy is more appropriate choice. Option D is incorrect because right upper quadrant ultrasound is helpful for diagnosing gallbladder disease or pancreatitis, and it would not be of any help in evaluating potential colorectal cancer. Option E is incorrect because sigmoidoscopy only visualizes the lower part of the colon, which may not be sufficient for a complete evaluation. For any suspected colorectal cancer case, we need the full visualization of the entire colon, which is why colonoscopy has to be performed in this patient.